Hi, I'm Dr. Sita with Insight Functional Health. Thanks for joining us today. Today we're going to talk a little bit about insulin resistance. And I put this into the Foundation series because I feel like it's an underlying problem in a huge proportion of our population. We typically think of this more when people get to be diabetic, but there's a very long on-ramp towards diabetes. And if we can intercept patients earlier in that on-ramp so that they never develop the disease, that's really the best place to intervene. And one of the ways you can look at that is by having a hemoglobin A1C checked. This is a lab that's probably done by your conventional physicians on a routine physical exam, and it's effectively looking at kind of the sugar coating or the candy coating of your red blood cells. Hemoglobin molecules, which are the molecules that carry oxygen in your red cells, um, are in your bloodstream for about 3 months because the life of a red blood cell is approximately 3 months before they get old and get recycled and you make new red cells. And within those cells, the hemoglobin can start to have little sugar molecules attached to it. And that process is called glycosylation. And so the more glycated your hemoglobin is, the more sugar your red blood cells have been swimming in on average. And it's roughly a 3-month average. And in this diagram, you can see the glucose molecules are yellow and the hemoglobin molecules are blue. And then the glycated hemoglobin is when those two combined. And so we're measuring that. And so I like that measure because it gives us a long time range as far as what's been going on for a few months, but it doesn't really tell you how stable your blood sugar is. So in these three situations, the patient would have the same average hemoglobin A1C. It's just that in one case that you get really wide oscillations in the hemoglobin, and here it's much more stable. And these wide oscillations can start to cause more problems. And so looking at that average and also looking at the stability can provide different aspects to how to address insulin resistance. I also bring this up because when your blood sugar is really high, it can start to damage one of the protective linings in the blood vessels. It's called the endothelial glycocalyx. And I did a separate video that talks about this a little bit more, but just the short version is that you need this layer in order to defend the lining of the blood vessels. And in patients who have diabetes, their blood sugar is fairly high a lot, and this level gets eroded away, and now they're much more likely to have vascular disease. But one of the things they get is microvascular disease, which is basically that the tiny capillaries get obstructed. And that's what starts to cause things like neuropathy and retinopathy, which is problems with your vision, and kidney failure, because the kidneys are essentially a filter with lots and lots of little bitty capillaries. So that having more stable blood sugar is pretty important. One of the other things that is important is just looking at the stability as far as symptoms, because when your blood sugar goes high, it requires your body to produce a lot of insulin to bring that sugar back down. And if you're bringing down a really high level, you may produce a lot of insulin and actually overshoot so that now your blood sugar is low. And that can start to cause people to have a lot of hunger and sugar cravings or energy crashes because they're constantly on this blood sugar roller coaster. So the more stable we can get that, the better it is from an oxidative stress standpoint, from a vascular health standpoint, from a hunger management standpoint. It's just overall much more stable. When I think about this, I think of diabetes and insulin resistance as a continuum. There's no one point. It's not like a step off point where you're normal, 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 and then you're pre-diabetic, and then you're normal, normal, and then you have diabetes. And so the more we think of that as a continuum and we try to get you onto the healthy end of that continuum, I think the better it is for your health overall. If this was helpful for you, you can feel free to reach out to us. We have a lot more content online on our website and also on YouTube. And if you're a patient in the DC metro area and you'd like to talk to me, you're welcome to go onto our website and schedule a discovery call. I see people via telemedicine in all 3 states, and then I also see people in person in Silver Spring, Maryland. Thanks so much. Have a great day. Bye-bye.